with PMD Alliance, and we have been thrilled to have been hosting this series since March. There have been about 70 of these episodes where we've connected online and heard from neuroscientists, physicians, experts of all kinds of backgrounds. And the series has always been facilitated by the wonderful Dr. Indu Subramanian. And we often got the question, but what about, we want to hear from Dr. Subramanian. When is she going to be the expert? So today we're so excited to have made that happen. And to also, I'm so excited to introduce our guest facilitator, Dr. Laurie Mischley. So the roles are reversed, Indu's in the hot seat, and Dr. Mischley, I'm going to turn the floor over to you to kick off the program. Thanks so much for being here.
Great. So this is an honor to be able to host this with my friend and colleague, Indu. I think it's, I was thinking about starting our relationship is truly, Indu is like a very socially generous at conferences. When we met, I think one of the qualities that stands out about her is the degree that she goes out of the way to make sure that people meet one another who might have something in common. And so it has been great over this COVID period that we have collaborated on some projects related to social isolation and loneliness and friendships and peer-to-peer relationships and what that does for people with Parkinson's and quality of life. And so this is an opportunity for me to have Indu take the hot seat, as you say. And Indu, you have started every one of these asking your guest speaker to introduce how they came to neurology and where they find themselves today. So before you dive into your presentation, can you just let the audience know how you got where you are today?
Yeah, sure. So I love the brain. I think the brain is really cool. And I went to medical school in Toronto, and I have an uncle who unfortunately just passed away in the last year, and he was a huge inspiration. I will show you a picture of my mom in a second, but my mom is one of the first women in, honestly, the part of India that we're from the sort of background that we're from, to go into medicine. She was like a total kick-ass, and remains still a kick-ass sort of rule changer and, groundbreaking sort of in every way. She lost her dad when she was very young, when she was 9. Her parents were, from a relatively, meager background. So they were poor when they grew up. She put herself through medical school with the notion that she was going to help people like her dad to get, better health and better health care. And so she's a family doctor in Canada and inspired me to be, as a woman in medicine, sort of think outside the box. And then my uncle, who's a neurologist, really sort of cemented my love for neurology and the brain. And when I started seeing patients in Parkinson's, I would look forward to them in, my residency. And that was like the names on the list that I always wanted to see more and more and, enjoy it. And so I was like, I guess that sort of solves it when you enjoy seeing a patient population and kind of fall in love with a group of patients and want to help them with, all of the day-to-day things that happen to them and their families, and, just really getting connected, as we all do, I think, who love this patient population. So that's sort of my road to where I sit today. And I'll tell you, I think through a set of presentation, maybe a little bit about me more through some photos. And I have a little bit of a surprise for Laurie, because as I was going through preparing this, came across some cool things that have happened with some of our research as well. So excited to be hosted by my friend as well, Laurie, here. So, and thanks again, PMD Alliance, for continuing this, dialogue and having this sort of cool platform to connect with so many of you out there. I know people are kind of struggling these days, given, all the stressors and strains and just the continued pandemic. And I think Laurie and I talked about the COVID fatigue, I guess, a little bit. People are kind of like in the sort of zone of kind of wanting it to be over already. So just kind of put together a little bit of a presentation that I can share with you about some of my sort of thoughts to sort of getting over the stress that continues to kind of affect honestly all of us as sort of, I think, months into this pandemic. So if you want, I can start.
Let's start the slideshow, and then I'll monitor the chat group. So people who have questions, just type them in as they've come up over the course of the talk, and then we'll leave some time for discussion at the end.
That's perfect. Okay. Well, Laurie had talked about, wanting to put together some slides, and hopefully you guys can see this. And I will try to share my slideshow here. Can you see that? Okay, cool. So here's my family, and I tell all of my patients that I do enjoy sort of connecting through this virtual medium a little bit. I kind of miss everyone, but this is our family in various countries. My parents here, I just told you about my mom, who continues to inspire me, and my middle sister also went into medicine. There's many doctors. These are my boys, these three right here. And my nephews and my niece, who I, dearly adore. And we do this Zoom thing every week, and we are learning together about our ABCs. And there's my nephew in Colorado and his little birthday here that we celebrated. So we try to keep the dream alive with celebrating the small things. My niece and her, she's the one little princess out of 7 grandchildren, and trying to celebrate, birthdays, which is, not as good nearly as getting together, but we are trying to keep the dream alive. And we literally are feeding each other's souls through this. I wish I could see my nephew, who's now, he just turned 2, but he pretends to feed me on a weekly basis. Here he is with a Kit Kat for Halloween, and I'm pretending to eat it through the screen. So, we are virtually connecting, not just with patients, but my own family. My parents live in Canada. I went to medical school in Toronto, and it's been sad for me not to see them, but we are trying our best to replace our, sort of specific love for each other with this virtual modality. And so we are literally feeding each other's souls. So we, as I showed you, should eat the Kit Kats. And here are my relatives showing off their garden produce in the summertime here. My parents are growing okra. My sister and her husband are, eating chilies, I guess, by the dozen here. But, so we are trying to collaborate in whatever way we can with family, and also with our folks across the world, literally. Here, we have a Zoom meeting with folks, including the editor of our journal that we published our paper in, Ray Chowdhury, who is loved by many. And many of these folks have been on our show here. And John Duda and I collaborate at the VA side, trying to inspire folks. And those of you who are participating in the Parkinson Foundation Moving Day will see us in this hilarious video that we shot, I think, 7 times, because John could not remember the website and how to say it. But, these sort of ways to get together. And here's our sweet Laurie, who is just on my coast, and we have almost a weekly, I think, check-in about how everyone's doing, and we try to have some virtual happy hours as well. So, we are trying to collaborate in whatever way we can. So Laurie and I have shared this really cool kind of collaboration around a poster idea that started maybe 2 years ago at a meeting, and then ended, well, kind of sort of in a cool publication. It's not really ended. I think we're still at the beginning of this sort of journey, talking about the synergy of pandemics that is before us. And I'll tell you a little bit about the research, and hopefully end with some more sort of positive notes. So I think I was really shocked, and I think many of you know that I have a background not just as a Parkinson's doc, but as a integrative medicine doc as well. I ended up getting my board last year in integrative medicine, and that came from a journey over the last, I guess, 20 years of being interested in Parkinson's and what we know about it, the medications that we give, the surgeries that we offer patients, but really a sense that we don't know all the solutions just from this sort of classic Western approach. So I ended up for my own work-life balance, getting really interested in yoga. I had small children, was trying to figure out how to balance everything as a working mom, and neurologist, and all the stuff that my patients would bring to me, I was really internalizing. So I ended up getting quite interested in yoga, mindfulness, ended up doing a deeper dive in many of these things, and getting boarded in integrative medicine, going to those meetings and really learning about these social determinants of health, which I think I really, as a Western trained doctor, had really not known much about at all. So, and Laurie, and I have shared some of these interests, and we've actually presented in these integrative medicine meetings, which has been kind of fun as a collaboration. So I learned that social isolation is really, really bad for your health. In general populations, we learned that it's as bad for you to be socially isolated and lonely as smoking a half a pack of cigarettes a day, or being obese. So we spend a ton of time in medical school learning about trying to help patients quit smoking, trying to help people lose weight, but we don't really think about this as a determinant of health. So I run a center of excellence at the VA. And I learned that, social isolation in veterans can really is one of the top reasons for depression, anxiety, substance abuse, and suicide, which is a huge, huge problem in many populations, but especially in vets. So when we started looking at this, we realized that there's very little knowledge about this in Parkinson's. And so we should really kind of look into this more. And a lot of this sort of was pre-COVID-19 and sort of ideas that, this social connection is as basic a human need as food, water, and shelter, but really with COVID-19 became all the more hugely important. So just to define things, I think people ask a lot about what does this mean? So loneliness is really the subjective feeling. So a subjective feeling that somebody has an emotional state in which they are having a perception of social isolation. It's a felt experience of being lonely. And really what has been helpful is to think about, the current situation where you feel what your relationships bring to you and sort of what you desire those relationships to be. And really it's this gap between what we have really as what we perceive that we have and what we really want. And that is a different sort of, it's a subjective feeling, but social isolation technically itself can be measured in ways in medicine, looking at things like, do you live alone? Do you have social network ties? Who do you see on a regular basis? And so I think it's important to think about this as a bit of a differentiation of sort of that emotional aspect of how we feel. So
before you go on, there are already some questions. Can you just talk to the introverts, people who like their alone time? Is that Parkinson's apathy and they're deluding themselves, or there are people who like to be alone and that they're fine with that? They can be healthy in spite of being alone.
Yeah, so I think that we've talked a little bit about this, Laurie, because you are a self-proclaimed introvert, which I still don't believe. But I think that being alone is not necessarily a bad thing. And some people have amazing spiritual situations and realizations when they are alone. So it's really not the fact that one may like to be alone. It's really this other sort of situation where you feel the need to be connected and you lack that connection. And so it's really this sort of gap between what you have and what you desire that really leads us to being lonely. And I think that many people, feel that they may be getting through life with being isolated and I can manage. But really, I think when we really look at this, there's really, a desire and a missing of something that is really, needed. And I think that, we'll talk a little bit more about sort of how you can measure this in terms of, ways that we're able to study in medicine. But I think, if you're an introvert and you feel like you're doing pretty well, I think generally people are probably fine, but it's really those people that think that they're doing okay, but really are desiring something different, I think is where sort of that gap really lies. And I think one of the other things that we have been missing is sort of the ways to think about connection. And so I think the slide about the 3 spheres that we've talked a lot about, that we as doctors are seeing people in our offices and thinking that because they come in, they look happily married with a spouse and the spouse is answering the questions and really seems to get what's wrong with them, that person could not possibly be lonely. But it's really that there's these 3 spheres of connectedness that one needs to sort of have addressed. And so that intimate sphere may be helped by, a partner, by a spouse that lives with the person. But then there's these 2 other sort of spheres that are really important. And so there's relational loneliness, where you have a friend circle, some other people outside of maybe the person that, is your spouse, that you can confide in, that you can talk to things through with. And then there's this collective loneliness, which I think speaks to sort of this bigger societal purpose that people need to have. And so, and the question is, do you, can you connect, for example, with a group of folks like Parkinson's patients through a support group like this and feel connected with a bigger purpose such as that? Or possibly, if you have other passions, let's say you're a veteran and you feel connected with a group of folks because of your, that purpose. I think that those sorts of things we aren't really able to really delve into sometimes in our interactions with patients. And I think until I started doing this research, I really wasn't really delving into much of this. And I think it's changed the way that I've been practicing, at least. And, Laurie, you can tell me a little bit about what your thoughts are as well as we kind of go through these. But I think people really are, when they're seeing this and hearing about this, I think there's a lot of this is kind of resonating with them. They're sort of like, oh, well, now during the pandemic, I do feel something's missing. I do feel that, I don't have somebody to confide in. I'm stuck in, four walls with another person. And it may be even a caregiver that's feeling, sort of that way, and that they really don't have anyone else to kind of, connect with. So that's been kind of something that I think has been helpful.
The only thing I think I'll add here is that I think sometimes we get in ruts and we don't know what we don't know. Like, we forget how good it feels to be touched. We forget how good it feels to have somebody ask, how are you? And so even people who think they don't need that might be pleasantly surprised that they hadn't realized all that package contains.
Absolutely. So I think that there's been sort of a history of doing some of this research outside of Parkinson's. So we know that stress is bad. Stress is bad for the body, that social support can actually help buffer stress. Stress and loneliness is actually bad for immunity. So when we think about an infection like COVID or the flu season, these sorts of immune boosters are definitely helpful. Cognition can suffer when people are socially isolated, and people become sort of, in studies, you can actually look at people who, when you isolate them, you can take away social connection and isolate somebody, for example, in sensorial. A lot of these studies are, with healthy medical students even, where you take away the sort of sensory input of connection, and people become hypervigilant quite quickly, and they actually start to fixate on socially threatening stimuli more than pleasant ones. So, and it really disrupts the sleep cycle as well. So you can actually take a healthy, individual who might be in their 20s, and by taking away, sensory stimuli, you can make them actually psychotic relatively quickly, within 36, 48 hours of this sort of, lack of sensory input. It can be quite scary. So, one can imagine for our Parkinson's patients and their loved ones in a pandemic, it can really be disruptive. And I'm actually corresponding with a colleague who was on this series, Javier Pagano Baraga, in Madrid, or he's actually in Barcelona. He talked about the effects of actually, serious lockdown where patients were not allowed to even go outside of their home, and the effects of that on mental state and mood and psychosis in Parkinson's within a month of this type of lockdown in Barcelona was actually pretty profound. He has a case series of, I think, about 30 patients that this affected, and I think many of us have seen this. So it's a big deal. And I think, even before the pandemic, we talked about the number of reasons why many of our patients might be socially withdrawn in Parkinson's. And I think when we were starting to do this research, we had no clue that we would be in the middle of a pandemic and how much more important, this would become central to so many people's existence. But, I think that the perceived stigma of some of the sort of motor symptoms, and then you add on the non-motor issues with apathy, depression, anxiety, it really, historically has led to some of our patients feeling socially withdrawn. And now with the pandemic, it's become all the more important.
Well, and I think I should have said this during the introduction too, that we didn't explicitly state that in the Parkinson's community, there is a lot of research that there is a Parkinson's pandemic here, right? Like, we are in the middle of an impending pandemic of Parkinson's. And outside of Parkinson's disease, there was this research on this pandemic of loneliness that was happening. And now on top of that, we have slapped COVID. And so this is where Indu kind of came together with these ideas of this convergence of these three pandemics, and people with Parkinson's are right at the center of all of it. So there really is a perfect storm here.
Yeah. So Thinking about Laurie and her research background, she has a PhD. She's really been a huge patient advocate for, looking at patient-centered outcomes. And so she has this really lovely way of surveying patients. And we hope that people will watch this and get their friends and anyone in the Parkinson's community to get involved, because we actually have another rollout of this ongoing questionnaire that's being rolled out, and we'll link that at the end of this talk. But so far we've had about 2,100 patients, participating. About 1,750 of them for this analysis had Parkinson's disease, and this was the CAM-CARE and PD study, which is a web-based questionnaire. It's an ongoing study that we have just rolled out a number of COVID-specific questions, looking at how patients are doing during the pandemic and trying to understand a little bit more in a deep dive about how COVID's affecting them. And so we looked at this in a cross-sectional way, and we were interested in, for this specific bite of the data, but we have other information on exercise that Laurie's talked about, diet that Laurie's talked about. We've talked about a few of these other things, and we'll urge you to check out some of our previous interviews with Laurie on this series, because I think we've had 2 iterations. If we'll show you how to get those information. But on this specific analysis, we looked at things like social activities and relationships and how satisfied people were with them, and also how well they were able to carry out their usual social activities and roles. And then there was 2 specific questions that we asked. One was about, true false statements. I am lonely and I have a lot of friends. And so we looked at this and we were trying to see how this predicted quality of life. And we were actually pretty stunned to see that something as obvious as tremor, that many people identify as one of the main things when they think about a Parkinson's patient, that tremor really did not affect quality of life too badly, but really the things that affected quality of life the most, actually, out of many of the things that we looked at in our survey, were the loneliness factor and the I have lots of friends. So having lots of friends seemed to allow people to have a better quality of life, and being lonely seemed to predict that people had a worse quality of life. So this was pretty remarkable, and I think it wasn't something that we would have predicted going into this survey, but it was a pretty impactful, I think, outcome measure. A lot of us on this series have talked a lot about exercise as something that could be protective and help with quality of life in Parkinson's patients. And here we see that being lonely is as bad for you as the positive effects of exercising 30 minutes a day, 7 days a week is good for you. And so when we think about the modifiable things that we can really help patients to get moving and get incorporating in their life to help them with their risk of worsening of Parkinson's symptoms, I really want to think about this in a positive way. I mean, we could think about it in a negative way with the double whammy of being, socially isolated and not active, but when we try to spin it in a positive way, thinking about how to get the best bang for the buck, I think that exercising with a friend is really, something that we really are encouraging. So that's sort of getting 2 positive sorts of things out of sort of the data, I think would be great. And then, when we looked at sort of the types of things that affected the loneliness seemed to affect, it really is in this non-motor realm. And I think we've had a number of speakers on this series, ranging from Ray Chowdhury, who is the one who is the editor of this journal, and who has really inspired many of us to care about the non-motor symptoms. And I think many of the patients that we talk to on a regular basis, we spend about 5 seconds talking about some of the motor issues. I'm joking, but it seems like many more of our conversations are around things like sleep, depression, motivation, things like that. And so really thinking about these sorts of measures, this is really, you see this, what we like to call the maple leaf drawing. These are the types of things in this lonely cohort. So this blue line here that seem to be much more affected in these lonely patients than even the motor symptoms. So again, another plug for caring about this social determinant of health. And Laurie outlined the sort of synergy of pandemics, the Parkinson's pandemic, which in the last 40 years, Parkinson's has doubled. It's slated to double again in the next 20 years. So we're really seeing many, many more cases of this globally, and we have to have many more folks that care about this, and doctors to and healthcare providers to help our patients and support them. But we also have this historical loneliness pandemic, and then on top of it, the COVID-19 pandemic. So it's not all doom and gloom, though. I think, this is a talk that is on, a sort of a time frame that we really wanted to bring some hope and inspiration and teach you about sort of what makes me tick as a person and why I do the work that I do. And similarly with Laurie, I think we all love Parkinson's, and we realize that it's a very treatable disorder. And our hope is to really get people thinking about this, social prescription as a way to modify disease in a positive way. And so, when we think about the Parkinson's pandemic, and these other pandemics, I think the social isolation worry with COVID-19 is really concerning. It can affect things around, stress responses, immune responses, sleep disruption, affect Parkinson's patients with not just their motor, but non-motor aspects as well, as I've shown you. But, and then this could lead to a worsening spiral in theory of further social isolation, so further social withdrawal. But I think we're excited to think about a way of modifying this with a really social prescribing as sort of what we're touting as a new sort of concept of, literally prescribing social connection to our patients. And I think signing up for this webcast is a way that you've already proactively sort of shown yourself that you can be part of a bigger group, be part of a solution, hopefully, and connect in some way through a few things that we will talk about. So literally, Laurie and I just gave this talk at the Movement Disorder Society meeting, which is an international meeting, and it was highlighted as one of the best abstracts, and it was just published in a journal of really, I think we were excited to see that it got published in Nature Parkinson's, which is to us one of the best journals out there. And so we're really trying to advocate for educating clinicians about the concept of loneliness, about the concept of being proactive when asking about, how patients are doing during the pandemic, what these three spheres, how are they, attacking these three spheres of social isolation, and then thinking about how we can proactively, literally prescribe social connection. And so we're talking about things like, getting on a virtual modality, for example, such as this, possibly prescribing proactive phone calls. And it's cool that I work at the VA and I run our Center of Excellence, and the VA has actually been quite proactive about this. And they have this thing called the Compassionate Contact Corps, which is literally a form of social prescribing in which veterans who are lonely are matched with volunteers that used to physically come in to the VA. And now they're actually being matched and to have virtual meetups, virtual phone calls, or old school phone calls for these patients. And so there's really been a push nationally at the VA side to think about this. And if you're not a veteran, there are some other ideas as well. The National Health Service has some ideas around working with this too. And this is the surprise, Laura. I just found this on the World Health Organization website that our awesome. Data was highlighted as something to care about for global literature on coronavirus disease. So
awesome. That is a great surprise.
So I think we're trying to, fight the fight, get the word out. And I guess the World Health Organization or somebody around them has looked at this as something that could be awesome. Impactful. So really kind of interesting. So again, thinking about that burden of COVID and why we sort of started to, outreach in this way. So I was really worried about our patients at the beginning of COVID. This was an article that came out literally week 1 or so of COVID from some of our colleagues in the UK, thinking about social isolation, the stress of it, the physical inactivity, and this downward spiral. And the notion that we could kind of think about things in a different way to keep our patients, connecting. And so literally week 1 of the pandemic, I was able to sort of think about some ideas. Actually, I'll come back to this and think about the collaboration that we have here with a number of folks, including the PMD Alliance, and really been excited to bring just a wealth of amazing folks to this series. And, Laurie's, I think, been on it 3 times at this point, but thanks again to the PMD Alliance. And so really thinking about ways that we can, be proactive for this, find your tribe, find a cheerleader, meet your neighbors, even if it's online at this point, joining a support group online, exercise classes online. If you were part of a religious or spiritual group, finding online resources. Many churches are meeting online. I know there's some virtual prayers that my parents are attending on a pretty regular basis. If you can't, do the online thing, even picking up the phone can be hugely important. I showed you real life examples of my parents and us all checking in with each other through Zoom, FaceTime, all kinds of things. I think a few other things that I wanted to urge folks out there and really thinking about our caregivers as well. This is National Caregiver Month, I guess, in November. And so we'll be having some offerings here, but self-care for all, really thinking about things like getting good sleep every night, trying to think about exercise as medicine, thinking about your body as a temple, hydrating it well, eating right, not just eating crap. Halloween's always a time to kind of have those diets go out the window, and we're going into the holidays, but, thinking about all the self-care that you can possibly do, mental stimulation. For those caregivers out there that are feeling, like they're just focusing on the other person, think about that oxygen mask analogy. So putting that mask on to take care of yourself before you can give to other folks, because we really have to care about you, because if something happens to you, we're not going to be, sure who's going to be able to help our patients out there. So finding someone to call, a battle buddy, checking in with people, whatever you can do. And then I just listed the suicide prevention line on here as well.
So some people are saying I wouldn't have thought to talk to my neurologist about my lack of friends and my sensations and sense of loneliness. Can you speak to that, about the role of a therapist and a neurologist or a counselor?
Yeah, I think that we as neurologists, we sort of put ourselves in a box sometimes, and we have 15 minutes to go over all this stuff. And, it's hard enough to, get a sense of, what the medications are on these virtual visits, let alone, how people are doing and how they're connecting. But I think what I've realized is that if my patients are not thriving in some of these spheres, then I can adjust the pills all I want, or, refer them for deep brain surgery or whatever. And it's really not going to make that huge a difference. It's really, some of these things are so greatly impactful and so poorly understood that I think it ends up being, for me, something that I've been really focusing on. Now, obviously, I might not speak for all neurologists out there, but I think many of the neurologists that are out there hopefully also have teams of other folks that are, in a multidisciplinary approach. So, nurses, allied health professionals, social workers, we have a psychiatrist that works with the VA, psychologists. I think you just have to, sort of understand that I think many doctors are not going to ask you this. So hopefully this is a call for action, even in our patients, to advocate for themselves, and really sort of, realize that this may be making a difference for you in terms of how you're doing, and really figure out a way to communicate with whoever, you may find that may be, accessible during this pandemic. And so, I think it may be requiring, even a primary care doctor, whoever it is, but I think, making this the, first thing you talk about on the visit, if it's really affecting you and it's, affecting your mental health, rather than waiting until, the end of the visit when, it would usually be the hand on the doorknob sort of time, or, the time for the doctor to click to the next person. I think leaving it as on that low end of the priority list would not be what I would recommend if it's really affecting you. And I think it is affecting a lot of people. So what's your sense of that, Laurie?
Yeah, could you actually flip back to the maple leaf drawing?
Yeah.
I think that just kind of drills it home for me, where I look just to let people know what this is that we're seeing. So these are 33 symptoms of Parkinson's, and everyone starts in the middle. And the more severe your symptom, the further out you make the line. And so what this graph says is that for every single one of the 33 symptoms measured, people with Parkinson's who identify as lonely are rating their symptoms about 50% more severely than people who aren't lonely. And so when a patient comes in and says, I'm constipated, I'm not sleeping well, my meds aren't working, and your doc responds with, well, how many friends do you have? Right? Like there is this whole thing that has to be bridged. And I think it really is difficult to both not to convey to the patient how their bowel habits, their sleep, their balance can truly biologically be affected by loneliness and social isolation, and their perception of symptom severity. But I just wanted people to really understand that some of the symptoms way beyond social isolation are playing themselves out as part of consequences of the loneliness. Yeah, so I think talking to patients in clinic is hard, but I think I don't think I use referrals to counselors, therapists, coaches, some of the ancillary providers nearly enough. I think I can't solve people's loneliness crisis, and they're having trouble solving it. And so we need more community members. I wish we had something like AA, where when, you had your mentor, your sponsor, something like that, I think is really needed in this community, where people have a Parkinson pal that is in it for the long haul with you.
Absolutely. No, I think these are all understood, and we just don't have great solutions, but I think, I think the pandemic.
Oh, and you just muted yourself. Can you unmute?
Sorry.
Yeah, go ahead. Sorry.
Yeah, no, I was just saying that I think we don't think outside the box enough, but I think, it may be your neighbor that might be your buddy or somebody else, but, it might be, something that is not necessarily the person who's sitting right next to you at home. We might have to kind of think a little bit outside that box. So I just wanted to show people this, this graphic as well. I and a colleague ended up kind of working on this, very early in the pandemic. And I think that what I'm realizing, every time I show this to people, this was meant for healthcare providers early on, as in sort of the emotional state of what many of us were going through: shock, betrayal, fear, foreboding, grief, terror, but there were also some positive things too. But every time I show this graphic, I'm also struck by how it affects each and every one of us, even if you're not in healthcare. I mean, I think many of us go through a range of these emotions every day, and we don't realize then why we're feeling not so great, and I talk to friends, family, oh, I haven't been able to sleep well. I haven't, I'm just feeling kind of blue. I feel just like I don't really want to get anything done. Well, I think we're all just sort of struggling with all of the things that are possibly listed here, and for a range of reasons. I mean, we just have a lot of different things going on in the world right now. So I think, it is one of those things where, we're trying our best, but, be kind to yourself. I think, we're all just facing a lot of these things, and as are your healthcare providers. So I think, when we say that, maybe these people aren't able to tap in, I think it actually segues well into the slide, is, being kind to ourselves, and thinking about each and every one of the folks that you meet on a daily basis. So many of us are trying to straddle all of these things, right? I mean, some of us are homeschooling our children, trying to take care of our elderly parents, worried about, all these folks, and really trying to be really great at everything is really not going to go well. I think a lot of folks are, trying to compare themselves to other folks. And I know I'm out of my friend circle, some of my friends are, publishing 8 articles a month, and some people are writing, their memoirs, and other people are going through their house and, painting every room. And that's just not going to be my existence. I mean, I think, we're really in a marathon, and it's not a sprint. If you, don't pace yourself, if you don't give yourself some days to just feel a little emotionally exhausted and, kind of sleep in a bit, take a break. Maybe you're not going to make 7-course dinner for everyone, or, have the best Thanksgiving meal that you ever were, preparing. But I think you just have to give yourself permission to kind of let some things go, not be perfect. It's okay if we have cereal for dinner once in a while. I mean, I think, again, just sort of being kind to yourself and giving yourself permission is just so key, I think.
As long as it's oat milk.
What is it?
As long as there's oat milk cereal.
Right on, right on. So I think a few other things sort of that have made me tick. So thinking about purpose and sort of getting some of this advocacy around some of the world. We talked about the International Parkinson's, the Movement Disorder Society meeting. Activism has been kind of exciting to me, I think. And I mean, there's so many cool things to advocate around. The Ending Parkinson's Disease book has been exciting, and the Parkinson's Pact. So if you haven't seen this, I think, I'd urge you to get involved. Bas Blom, Mike Oken, a lot of these folks have been doing some really cool work. The PD Avengers have really been inspiring. And we've had, I think, all of them on, or many of the founding members, who just each of them have, a remarkable story in and of themselves. And so I urge you to go back and check those out. We've had, a whole host of just really fabulous speakers over time. I've been doing some blogging. We've had Laurie's work on the Parkinson's Secret blog. And I've enjoyed writing. And I think, folks who may have a creative side, maybe think about writing, telling the story. Sometimes it's good to just sort of write things out and have sort of a sense of things. Other things that have really been speaking to me, just to kind of go through this quickly, is some yoga, which everyone knows. I've been partnering with Matthew Sanford, who's just been inspiring. He came on our series. Nikki Myers, you were just talking about the AA. Nikki Myers is an amazing woman who teaches yoga in, I think she's in Indiana, has a background in addiction, herself had a tremendously stressful life story, was in jail, was in sex work, all kind, addiction, drug addiction. Really amazing person who uses sort of the AA kind of concepts along with yoga to really help people. So I urge you to check her stuff out. Richard Rosen, who's a Parkinson's patient, who is one of my mentors as well in the yoga world. I like this quote: "The body, not the thinking brain, is where we experience most of our pain, pleasure, and joy, and where we process most of what happens to us. It is also where we do most of our healing, including our emotional and psychological healing. It is where we experience resilience and a sense of flow." So this is kind of, I love this quote. I think that, it's sort of been a nice way to connect yoga, the mind, the body, the brain, all these things together. And I think, very inspirational. Many people know that I also have an interest in mindfulness. So some of my fave mindfulness teachers, Sharon Salzberg, John Kabat-Zinn, who's the father of mindfulness-based stress reduction, Jack Kornfield, Roshi Joan Halifax, and Frank Ostaseski have been inspirational. I will skip over this. Atul Gawande is an inspiration. I've been doing a lot of reading as well during the pandemic. So some great titles for those of you who want some ideas. Vivek Murthy, who is a huge inspiration in some of the loneliness work that Laurie and I did. And then Viktor Frankl, who continues to be just such an inspiration. So a couple of quotes from Viktor here. I think I'll just read you these two. "Everything can be taken from a man, but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way." So I think, this has been inspirational for me. And then between stimulus and response, there is a space. In that space is a power to choose our response. In our response lies our growth and our freedom. So I think, many folks are suffering right now, but I've been inspired by some of these thoughts to sort of think about the way we respond. David Kessler's work has also been very inspirational to me. And so I come to a few thoughts on silver linings, but maybe before we do that, Laurie, we can, if there's any other.
Yeah. Let's touch on some of these questions. So Dr. Duda is on the line. This is kind of a two-part question. He wants to know if there's any data that these Zoom meetings actually kind of fill the void, that how close are we getting to real social connection? And then tied to that question, we have some self-proclaimed huggers who are really missing touch, and they're asking for advice on that.
Yep. So, so I think, I don't know if we have exact data on Zoom. I can tell you that I showed you some pictures at the beginning of this about my family and our family time. And I think this is a weekly thing that we do. And I basically force my teenage boys to sit there and watch their 2- and 3-year-old nephew and niece pretend to feed their mom on a weekly over Zoom. And I don't know. I mean, I think at some point it's quite interesting because I've been doing a lot of yoga training and mindfulness training on Zoom as well. And at some point, I think there's sort of an instant where you kind of lose track of who and where and what in space, and you are connected in some way. So I don't know the data, and maybe John has some sense of that and how we would study that, honestly. But I think, I think short of not having anything, I think we definitely, this is something that we are able to do. And I think, the folks at PMD Alliance have been great about connecting people also through Zoom, which is part of the hang up, and I think, to get into people's space, even through a phone call, I think is sort of not as good as this, but I think, is something. So I don't know. I think, do you have any thoughts on that, Laurie?
I think it's the best you're going to get. I've been doing more outdoor stuff. I need to get off my screen. I mean, I am addicted to my phone and spend too much time in front of the screen. And I think these have been fabulous. They are the best we have for right now, but I really think going out of your way to go for a walk with a real person, keeping some distance and doing it outdoors is a different kind of valuable.
Yeah. Yeah. And also, I mean, I think one of the things that I've been noticing with patient interactions in the office is that I am a hugger. I'm a huge hugger, and I do miss that tremendously. But one of the problems with, seeing people in the office with the mask on is, especially if you have expressive eyes like mine, people always think that like I'm angry. It's hard for me to smile with my eyes. So this lack of facial, interaction is also problematic, I think, even in person. So I don't know, at least with the Zoom interactions, I think I can at least see the patient's facial expression and have a bit of a sense of that. But I don't know, does Dr. Duda want to unmute and tell us what he thinks? Are we able to have him on here?
How did that?
Well, maybe we can take that. And you were also asking about the hugging, Laurie. So we can, Andrea, maybe you can find John and get him on here to say something. But I would say that with the hugging, I think there's a huge amount of chemicals that flow with oxytocin and things with hugging. There's a lot of things that we're missing right now. So I'm actually hoping to work with Matthew Sanford and some of the yoga folks to figure out, there are some practices that you can actually do with self, sort of touch and grounding practices and stuff that can replace that a little bit. But I think, Laurie, you and I have been even talking about the pets and things, and if they need things a little bit. So is John on?
Yeah,
John?
I'm on, Indu. How are you doing?
Good.
So I don't think I have any real solutions to it. I think everything that you guys have been saying, I would agree with. There's a lot of aspects to wellness, and interpersonal connection is one of them. So I think trying to strengthen some of the other aspects, including stress reduction through mindfulness meditation or forest bathing, going out in the woods. I just spent a couple of days out in the woods with some friends, and I think all those things are great, and doing yoga and eating right and getting enough sleep and everything. So I don't know. I haven't seen any strong evidence that there's an easy solution for a lack of social connection on a personal level rather than over Zoom or something like that. I think there's some evidence that the latter is helpful, but I'm not sure we're ever really going to get past it. I too am a self-proclaimed introvert, and I'm doing fine, but I do have lots of patients who are not, and particularly my patients who have cognitive impairment and just don't understand why they can't see their loved ones, or everybody's wearing a mask, or things like that. I mean, it's been really tough on a lot of people. So I love the stuff you're doing with the VA, with the network of volunteers to fill that void and everything. I think expanding that kind of stuff would be great. And I think there may be a role for that for the PMD Alliance or Parkinson's Foundation or something like that. But yeah, it's a challenging time, and it calls for innovative solutions. And I applaud you guys for the work you're doing to try and raise awareness of it, and hopefully we can make some inroads into solving it.
Absolutely. Well, thanks, John. I'm glad you could join us. And John is my counterpart on the East Coast for running our centers of excellence, and we work together to try to help our patients with Parkinson's, through the VA, and it's really our mission and our love. So thanks, John. So a couple of I guess we can put some ideas about silver linings, and maybe people can also type their silver lining in the chat. What is the one thing that they really speaks to them about the pandemic that has been a silver lining for them? So these are a couple of thoughts. So silver linings. I think for me, it's been taking a moment to pause and reflect, to be present. I think many of us would be on the next flight, running around like the chicken with our head cut, chickens with heads cut off. So I think this has been some time to reflect a little bit. I'm realizing how uncertain things can be and what we've taken for granted in the past, realizing how important social connections are and our global connection to one another. So we realize that, something that happens in China, a virus that starts somewhere can affect each and every one of us here. Having a new respect for the planet and Mother Earth. I mean, I think that's been, huge, how much time people have spent in nature. I showed you my parents and their garden pics and stuff, and I think we've been connecting more with our backyards more. Realizing that altruism is important, preserving our future, that something that I can do, by wearing a mask can prevent you guys from getting sick. Gratitude for people that I never would have thought of, the people who clean the hospital, the people who, the teachers that are fighting to keep our kids educated, the grocery store workers that were tirelessly stocking those shelves. From the healthcare perspective, I think there's been some silver linings for me, thinking about, social inequalities in a very different way. We're realizing that COVID-19 affects populations that have been underserved, and that these need to be addressed globally and locally. And, these are systemic issues that really need to be changed. And we're trying to, bring some of that. We had one or two speakers talking about that. We hope to continue to bring some of those issues to light here on this series. Trying to think about breaking down barriers with telehealth, insurance, isolation. I still worry about our patients who don't have internet access, who don't have computers, who live rurally. We have to find ways to connect with them. I've been giving some talks to folks, even in the technology world, about finding ways to embed an iPad with internet that's cheap and figure out ways to, make it accessible to people who might be, at risk for getting scammed. How do we connect people without opening up the world to some of our vulnerable populations? So I think we really just need to figure out solutions together. Thinking about the team and the healthcare team as a whole, breaking down the barriers of I'm the doctor, you're the nurse, and you're just, somebody else. We're all working together as a team. And I think that we're thinking about our integrative medicine providers, the mindfulness teachers, yoga teachers, or new heroes. And even in the palliative care world too, I think we're really trying to build ideas around advanced care planning. And I had brushed over something here. I ended up writing a paper about hoping for the best, planning for the worst. So palliative care approaches to Parkinson's, and thinking about, the what if concepts of what if the caregiver gets sick, who's going to take care of the patient. So this is actually open access as well. Urge you to take a look, and Andrea will link that as well in her handy dandy way. And then, and then I think, we have some new opportunities. So thinking about all the folks that I'm grateful for includes Laurie and John as well, and the PMD Alliance. So thank you. Any other thoughts, Laurie, about your silver linings? Have people been typing things in the chat? I haven't been.
People have had a lot of comments. I think, the one thing that I will add is that we are all getting this fatigue of quarantine fatigue. And I think that there is this balance between making smart decisions about maybe your mental health does require you to double bubble with one of your neighbors, where, there's you minimize the risk. You sit a little further apart when you have dinner together, but you do invite a neighbor over for dinner once a week just to maintain a connection. And there is a way to get creative. At Halloween this year, it was great to walk around my neighborhood and see people dropping things from 2-story buildings and levers and catapults. And people had all these creative, clever ways to bridge that social distancing gap while still engaging and interacting with one another. And in Seattle community, the tennis courts are full and people are playing pickleball all over the place. People with Parkinson's love playing pickleball. I mean, you can keep some space, it's outdoor, they're having fun with it. And so I do think that there are opportunities here to be creative. I think there are more online programs, and truly, I think that people with Parkinson's have more access globally to the offerings that this community has had than they have ever had, right? You know, COVID has brought this program to the table, and I have referred patients to the PMD Alliance series probably 100 times in the last couple months, where for the, you know, the urinary one, the balance one, I think that it has filled an unmet need. So I think I do see some silver linings, and this is temporary. This is temporary. And the last thing I will also, my own 2 cents is, as we deal with this COVID fatigue, this quarantine fatigue, I will just say, being lonely and healthy is still so much better than being lonely and sick. And I do want to say this winter is going to be tough, and we have, you know, one more push. We've got a few months to get through, and I do think that the worst will be over. But I do think it's really, really important for all of us to practice prevention. It's as difficult as it is. It's way easier than dealing with the consequences of getting sick. So I wanted to put in one more push for hold tight, don't give up yet. People are saying thank you so much for having this series available. People talk about apathy and the facial expression being an issue for the mask making it harder to communicate. People are asking about pets. What do you think about running out and getting a pet?
I don't think it's a bad idea. I think Laurie and I are going to be incorporating in our new, and Laurie, I do want you to spend a minute just telling us about your, how to get involved in this study.
Yeah.
You know, because I think we're trying to get the last we've had a few folks in the PMD Alliance have spread it around through email, but we're trying to get, you know, the push for trying to get some of the data back relatively soon so that we can analyze it, so we can really think about, you know, what next you know, offerings to you know, help our patients with, and where to be focusing our future research as well. So we'd love to have a little bit of information on that. But I think, you know, one of the things that we did ask more about this time was dog, cat, you know, pets around that. And I know a lot of people that spend a lot of their love on their pet, and I think that's great. And I think, you know, if you can safely take care of one, you know, I think getting one is a smart idea, or even, you know, having a neighbor who maybe you can, you know, have the dog run around in your backyard for a bit so you can enjoy it. But, you know, pets are work too. I don't have, personally don't have pets. I have 3 boys, which sometimes requires some interesting cleanup around. But, you know, so if you are able to, I think it's a good idea. But again, think about the consequences. We don't want, you know, folks to be getting pets because we said so and then not be able to take good care of them. So.
But I do think it's really helpful to have something outside of yourself to care for. And I think we also should touch on volunteering as is in this world of social prescribing. It's really impressive to see that you almost get more bang for your buck by volunteering. Socializing is good, but helping somebody else is incredible. Yep. And so maybe you can end with how people could get involved with their communities and how helping someone else can be medicine for themselves.
Absolutely. Well, it's interesting. So, you know, I think a lot of folks with Parkinson's are fiercely independent sometimes, right? And they're like, I don't need the help. I'm good. No, I don't, you know, but sometimes just letting somebody help you is actually really healthy for them. So if somebody wants to buy you an extra roll of toilet paper or pack of toilet paper because they're going to wherever, let them, you know. And I think if you can get, think about, I think those folks that are less fortunate than you, I think that's been tremendously empowering for me and enriching for me, is when I'm down, you know, these people that I listed, you know, Sharon Salzberg, you know, Matthew Sanford, Nikki, I mean, these people are just tremendously just inspiring on every level. And, you know, I think, you know, when you're feeling down, there's always somebody who's less fortunate than you that you could give to. And I think that can be a tremendous, you know, morale booster, tremendous, you know, health and wellness through volunteerism. So I think, you know, maybe if you used to go to church and people are physically distanced and you know those people who are less, you know, sort of connected than even you, think about, you know, maybe getting, call up the priest or whatever. Are there 10 people on that list that I can call, you know, on a weekly basis that I can check in with? I think, you know, that will feed your soul. And, you know, I think it's not perfect to be connecting through these virtual modalities, but I think if you can, you know, think outside the box a little bit, you know, get connected, even a phone call can be tremendously enriching. So, we miss seeing all of you in person. We miss those hugs. We miss seeing each other in person a lot. John, Laurie, and I would have probably met 3 or 4 times. These 2 self-proclaimed introverts that I still don't believe are introverted are, you know, dearly missed by me. So anyway, stay safe, everyone. Stay healthy. Think about the effects of stress on your body. It can be, I showed you, tremendously problematic for your sleep, tremendously problematic for your immunity and for your wellness. So find ways to disconnect from all the TV and craziness. Go for a walk, go in your backyard, sit in the sun, you know, smell some roses, forest bathing, as John said, you know, very healthy. So, and phone a friend.
So this video will be posted on YouTube afterwards. I hope some of these comments will also stay up for a while. People are posting a lot of resources online. Twitchy Woman now has a mentorship program for newly diagnosed women. People are talking about other exercise programs and online resources that they have found to be very, very helpful. So we will leave these comments up somehow as part of it, right? And
yeah, we'll link them.
Yeah, we'll link them. So, Indu, thank you. That was really fabulous. And
thank you, Laurie, for being my guest host. So lovely to have you.
Thanks for bringing us all together.
Yeah. I'll hand it back to you guys.
Yes, well, we'll show our gratitude and appreciation with a hearty wave goodbye. So invite everyone to turn on their video if they've had it off. And I'd like to scroll through the gallery view and just see all your smiling faces. So good to see all of you. Thank you for joining us. Such good questions and good comments. Absolutely. Bye now.
Bye.